Today we're at Moss Creek, one of the system's most unique treatment centers and innovative programs. Join us as we explore the benefits of the Wound and Hyperbarics program. Okay, we're here at St. Joseph's Candler's Wound and Hyperbaric Clinic, and we're talking a lot about care and what types of patients they see. And now we get to talk to the experts who are sitting down with us today. Dr. Husong is here along with Susie Workman, who's a practice manager. Thank you so much for having us today. This is a treat.
Well, thank you.
Thank you.
We're going to learn a lot about the care that you're able to provide here. I want to start by really giving our viewers an overview about what it is that you do here at this specific location.
What we do is we take care of chronic wounds, chronic non-healing wounds. So it's not just your average type of wounds that we take care of. We take care of people that have maybe vascular issues, diabetes, other medical problems that don't cause their wounds to heal as fast as we would like.
Yeah, and one of the things, of course, that is so important to that care is the facility itself, because there are some major pieces of technology behind us we're going to get to a little bit later, but also, of course, the staff and the experts that you have here. So let's talk to you, Dr. Husong, a little bit about, what kinds of things you're able to do here in terms of treatment plans, on a general basis.
Well, this wound care center has been here since 2011, I believe. I'm the only remaining original person. So as a wound care clinic, we, as Susie already pointed out, we take care of chronic wounds, difficult to heal wounds. And so many of our patients have already been somewhere else, been undergoing treatment elsewhere. And what we add is not only experience, but we are dedicated solely to wound care clinic. I'm a general surgeon by my real job, I say. So I'm out here one day a week, and a lot of general surgeons do wound care, other physicians do wound care. It's difficult to do in a regular office. It's time intensive, it takes a lot of supplies. So we're able to add supplies. This facility is managed, it's St. Joe's Candler, but it's managed by a company called Healogics, the national wound care company, with very good protocols that are set in place to help the nursing staff, medical staff, treat these patients. And we offer additional things, again, that are not available in most offices, what we call skin substitutes, engineered skin or sometimes cadaveric skin to apply to wounds that help healing. We offer different forms of what we call offloading to reduce pressure on wounds to facilitate healing that many offices don't have access to. Compression is another component for those with swelling or venous disease that we can easily apply here. And we have a whole array of dressings to apply to wounds. I tell my patients all the time, the dressing alone is important, but not the cure for some of these wounds. If it was that easy, we would not exist. But we have a whole gamut of treatments in addition to the hyperbaric chambers that are behind us.
Yeah, and I can't wait to dive into the technology that exists here a little bit later, as you spoke to some of the things that are here at this clinic that you just can't get elsewhere or are difficult to get elsewhere. So we'll do that in a little while. First, though, we're going to hear from another doctor that practices out of this clinic and learn a little bit more about some of the things they're able to do. Dr. Husong, thank you so much. And of course, Susie, we appreciate you.
Thank you very much.
We appreciate
Thank you.
That's why we'll be right back after this break. Stick around. Welcome back in. If you're just joining us, we're here at St. Joseph's Candler talking wound care and hyperbarics. And now we're joined by Dr. Young. Going to check in with him and see a little bit more about what they do here. Nice to see you.
Nice to see you too.
So thanks for taking a break with us. Literally just a quick one here, but we want to talk a little bit about what it is that you do here and what types of patients that you're seeing.
Well, at the wound care clinic here in Moss Creek, patients come in with low extremity. I treat particularly low extremity wounds, so anything below the knee. So we have wounds predominantly from diabetics, but we also have people with circulation issues and so forth, or even someone with trauma. But either way, it's just a wound that's open And what we try to do is try to get it healed as quickly as possible before, or if it's infected, clear that up, and if anything, try to preserve as much as possible.
So a variety of folks that you're seeing, of course, depending on scale. I'm sure there are different treatment plans. Let's talk a little bit about some of those treatment options that you're able to provide.
Well, one thing for sure, in regards to wound care, the misconception is that you can just basically put a Band-Aid on or whatever it is and it'll just eventually heal. And that's not the case, because each patient body wound itself is very particular, it's very special, and it takes a little bit of time for us to get used to and get to be familiar with that wound. And we cater a treatment plan that will actually optimize its wound healing. So some might be just a diabetic, some might be poor circulation, infection, what may be, it might be even just this pressure or mechanical pressure. But either way, it takes a little time for us to cater a plan, so there's not any particular one way of treating it.
Yeah, well, which is why we need the experts, right? Because everybody's unique and every situation, of course, is very individualized. So you're able to tailor that treatment plan to the individual case. Let's talk a little bit for our viewers who are watching. I'd love to just share, what are some of the most common questions that you get when people come in, maybe misconceptions?
Well, I mean, there's a couple things. I mean, this clinic is not just wound healing, but we also do hyperbarics. So one of the big misconceptions with hyperbarics is, hey, is this something I can pop a person in here, get them oxygen and it'll heal? And no, it's not really quite. It's not like a toaster or anything like that. There's a little more science to it. The wounds that we typically see come in, and mostly it's diabetics, and people come in and because they're diabetic and they have some predisposition, they don't perceive it correctly. So they'll think it's really not that bad. And so I get some patients who come in and say, geez, it should be easy to heal. It shouldn't take that long to heal. And they're quite surprised to see how long it takes to heal. And sometimes they'll be quite surprised when they find out it gets infected or it gets worse. So, thankfully we're here to prevent that from happening.
Yeah, it can be quite complex, and to your point, sometimes the healing process, really does take some time and needs the advisor of an expert to make sure that we're doing the right processes. Let's talk, we got about a minute and a half, about some of the outcomes that you've been able to see here. I know in your work, probably some of the most rewarding part is when things go well and things heal and you're able to see a successful outcome. Highlight a few for us.
Well, a couple things too. When we have patients who come in here, usually at the end of the rope, I mean, they're really frustrated from not healing, and then they're emotionally and psychologically beat down. And when we actually get them to heal, we control the environment, swelling, all these different things. When we optimize the environment for them to heal, and when you do heal, they're really happy. I mean, they're more than grateful. The fact that, one, we got them to heal. Two, we actually preserve any limb loss, because unfortunately that does happen, and with this getting them to heal quicker, we prevent that from happening. So.
Absolutely. Well, anytime you can, get a patient outcome like that, or a positive success story after a long journey, I know that's got to be rewarding for them and for you as well.
Yes.
Thanks for taking a minute with us. After the break, we're actually going to go back into the hyperbarics chamber area, get to show off that machine a little bit, but thanks so much for your time.
Thank you.
And thank you for yours. We'll be back right after this. Welcome back in. If you're just tuning in, you're watching Living Smart in the Lowcountry. We're learning about what they do here at St. Joseph's Candlers, and we're here in the hyperbaric chamber room. It's a mouthful and well-deserved because it does a lot. It's a really important piece of machinery. Dr. Husong is joining us again to talk us through the science behind this. Thanks so much.
Thank you again.
Yeah, so let's talk about oxygen therapy just as a general term. What does that mean? What does it do?
A hyperbaric oxygen chamber is an enclosed chamber. The patient goes in the chamber, the entire patient, and they are submersed in 100% oxygen. It's called hyperbaric because it's above normal atmospheric pressure. Right now, you and I are sitting in a room, and we have what we call 1 atmosphere of pressure on our bodies. In the chamber, we go up to 2 atmospheres. And when you put the oxygen under increased pressure, it increases the amount of oxygen you can get dissolved in the bloodstream.
Okay, so some really important technology and science behind it. So it's really helping to increase blood flow, oxygen in the blood. And how does that play a role specifically when you're talking about some of the treatment plans that you're asking people to undergo here?
Well, again, by increasing the amount of oxygen, we don't increase the amount of oxygen carried by the red blood cells, but we increase the amount of oxygen that gets dissolved into the blood itself or the bloodstream. In that way, the oxygen, when it gets to the difficult to heal wounds that usually are a little bit what we call hypoxic, meaning not getting a lot of oxygen or necessarily blood flow, the oxygen can diffuse out further than what's in the normal blood carrying system. And that helps promote new blood vessel growth, helps kill bacteria, helps promote healing in general.
Okay. So one of the things that I've learned here is oftentimes when people are seeking treatment here or seeking care here, this isn't their first stop.
Correct.
So they have definitely been under some other treatment plans or seen some other physicians, and then they're coming here for this particular plan. So what is it that puts a person in a place that this would be a good step for them?
There are 2 different kinds of hyperbaric oxygen therapy, what we call on-label and off-label. In a facility like this, we do on-label, which means that we do the several criteria, there are like 13 of them, that are approved by Medicare. Now we don't do all of those because we are an outpatient wound care facility, but primarily we do diabetic ulcerations, foot ulcers. They have to be a certain what we call Wagner grade or score and have to be present for a certain amount of time. And hyperbaric oxygen has been shown to be beneficial for those patients, reducing or increasing cure rates from perhaps maybe 56% to about 75%. We also have wounds with what we call osteomyelitis or infection in the bone. The hyperbaric oxygen is helpful for those patients if they've not improved with traditional antibiotic therapy in 4 to 6 weeks. And then we also treat patients with radiation injury. Most commonly we may see patients, male patients have had radiation for prostate cancer. They can get inflammation of the rectum or the bladder and with some bleeding, and they respond to hyperbaric oxygen therapy. The other you may see is a breast cancer patient, maybe post-surgery with post-radiation and difficult to heal wounds. We can treat those patients with hyperbaric oxygen therapy.
Wow, that's an incredible list of things that you're able to utilize the machines for. You know, with all of those different things that you mentioned, I'm sure a lot of questions come up, and we have about a minute before we go to break. What are some of the most common questions or misconceptions that you get?
Probably one is that we can treat everything with hyperbaric oxygen. And again, as I said, we do on-label, which means we're limited to certain diagnoses. And we do have to go through some hurdles of documentation, research, to get people qualified. We also have to, once we start therapy, we have to reassess. And if we're not seeing improvements, then we're obligated to discontinue therapy. Fortunately, we see improvements with most everyone doing the therapy.
Wow, really impressive technology and a lot of great things that you're able to do here. For our viewers who are watching, who are wondering a little bit more about how it works, how it feels, what you need to do to prepare, we're going to bring a patient in and answer some of those questions. Perfect. Thank you so much, Dr. Husong, for your time.
Thank you.
We appreciate it. All right, we have more. We'll be back after this break, and we hope you'll stick around. Welcome back in. You're watching St. Joseph's Candler Living Smart in the Lowcountry, and we've talked about a lot of smart technology that they have right here on site. Talking, of course, right in front of this hyperbarics chamber, an impressive piece of machinery, and there's 2 of them here. We're going to learn a little bit more about how to actually prepare for an appointment here. Susie is back with us now, and we've also got a patient joining us. This is David. Thanks for taking some time with us today.
Sure.
So a lot to know. I want to get a little bit of feedback about your experience. To start though, I want to share with our viewers, Susie, a little bit about specifics on how to plan for an appointment here? What do they need to do?
So in order to make an appointment here, all one would have to do is get their medical records from their general practitioner, any important labs, any important x-rays that they might need, and then all they need to do is give our office a call and speak with our front office coordinator, Caitlin Rowland, and we'll go from there and schedule an appointment with one of our physicians.
So you can actually self-refer, it sounds like.
You can,
That's
yes,
nice to know.
as long as you have some sort of medical records that our physicians can look at prior.
Wow, very helpful to know. Okay, now the specifics about what do we actually do to get ready to get in, because we learned a little bit about the science behind this machine. And so there's some things you need to know before you actually hop in the machine. What do we need to know?
Well, number one, a patient needs to have scrubs on, and they are not allowed to have any kind of metal on their clothing because our machinery is very expensive and it can actually scratch our equipment very easily. So no earrings, no zippers, so that's why it's important that when the patient gets here, we'll have them go into our room and put a pair of scrubs on and make sure they remove all their jewelry or whatever before they go into the machine.
Okay, so some details we don't want to forget about. All right. More importantly, though, is really talking about the outcomes here. And that's one of the most impressive things about the science of this machine is what it's able to do for you in terms of care. David, I'd love to hear from you to talk to us a little bit about how this was able to help you.
Basically, primarily, I did it because Dr. Hussang told me to. But it's supposed to increase the oxygen in your blood, speed up the healing process, and get you better quicker.
Absolutely. Well, and that's what it's all about, right? So you want to get better, of course, but the quicker you can get your care to be working for you, the better. And sometimes with wound care, it really can be, a long-term process and some of the other things that you're treating here. So having this to really help that treatment plan is important for folks to know. All right, let's talk a little bit more about this plan specifically now. Is this a treatment plan that you do once? Is it something that you're doing weekly? Talk to us about how often.
I did it, I'm pretty sure, at least 4 times a week, and it is something that generally involves 16 visits, 20 visits, but it's worthwhile.
So you get to know the folks here pretty well.
Oh, intimately.
I've heard the staff is wonderful. Touch on that a little bit, if you would, about the level of care you were able to receive from the personnel here.
Oh, well, they're outstanding. I wouldn't probably have a social life if I didn't come here. They're really neat, interesting, and very professional people.
Absolutely wonderful. Well, I think that's great for folks to know anytime you're going through, any kind of a treatment plan, really being able to go somewhere where you're comfortable, especially, when you're going through something that might be a little bit, uncomfortable in terms of just mentally what you're dealing with. I'd love to, before we wrap up our show today, Susie, for you to give our viewers at home a little bit more about what to expect when you're actually in the machine. Do you hear anything? Do you feel anything? What is it like?
You don't hear anything, you don't feel anything. You're actually able to watch movies, videos of your choice while you're actually in the machine itself. And if I might add one more thing, normally treatments in the HBO machine are 2 hours. And we like to do it at least 4 times a week, if not 5 times a week. We just get a better prognosis that way.
Yeah, well, that's helpful to know. Anytime you can ease people's minds with a little bit of information, I think that's great, and hearing directly from a patient, even better. So thanks for doing that today. Sure. We appreciate it. Lots of great things happening here, trying to get you healthy. We'll be right back after this break. Thank you so much for joining us. We hope you found this beneficial and educational. For more information on these services or any others provided by St. Joseph's Candler, please visit their website. We hope to see you next time on St. Joseph's Candler's Living Smart in the Lowcountry.